Your doctor has suggested you watch this presentation on medial epicondylitis or golfer's elbow because he or she thinks it may be helpful to you to see some more information about the condition. Typically, golfer's elbow or medial epicondylitis involves pain at the inside part of the elbow radiating into the forearm. It's caused because there are muscles tying into that particular bone that may become damaged or inflamed as a result of certain activities. Activities such as golf, hence the name golfer's elbow, but repetitive activities that involve you gripping hard and usually flexing the wrist. So typically hacking or banging or hammering, that sort of activity. The pain is present there at rest, but it can be that it's only provoked by certain activities such as gripping or bending the wrist to one side. Also, if you bend down the wrist and resist straightening it, that will reproduce the pain up here. The area that is painful will be tender also. So those are the features of medial epicondylitis or golfer's elbow. They can be helped by a program of strengthening and stretching. Now they'll be helped by other things such as medication or topical rubs or injections, but the exercise program can be adapted in addition to any other strategies or exclusively as a way of treating and managing this pain. For medial epicondylitis, I'm going to show you some stretching and some strengthening exercises. First thing with stretching is lock out the elbow, lift up the hand and pull back. You can do that up against a wall or with your other hand. And that stretches these forearm muscles. For strengthening, you need to strengthen the flexor muscles of the forearm. First of all, you can do it easily with lifting the hand against gravity, using gravity as the resistance. And as that gets easier, you can use a small weight like a bottle, with or without water, and you can just increase. And what you're going to do with the weight or without it is you're going to just lift, hold 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax it down 1, 2, 3, and repeat that about 10 times twice a day. And you should just feel a bit of fatigue at the end of that sort of an exercise session. You also need to strengthen the pronators, and for this again we use the bottle over the edge, fix your forearm, and you roll the hand from one side to the other and hold 1, 2, 3, and the other way 1, 2, 3. And as that gets easier, you then can lengthen the bottle or increase the weight, and that gives more work for the pronating muscles to work and strengthen them further. And that program of stretching and strengthening will promote healing, reduce the amount of symptoms you're having, and reduce your chances of re-injury. So those exercises that help you to strengthen the muscles that are involved, to stretch them, will promote healing, and over a number of days or weeks you will experience improvement in your symptoms, and you should be able to return to the injurious activity with confidence that it won't provoke the symptoms again if you have strengthened up the muscles sufficiently. If the symptoms don't improve steadily and resolve with that program, then the diagnosis may need to be revisited, or you may need more expert attention from your doctor or a physiotherapist.